I'm Melanie. I'm one of the hygienists in the office, and today I want to talk to you about really what happens in your cleaning appointment. You may think that you're just getting your teeth cleaned, but there's so much more to it than that. The exam starts right when we meet you at the waiting room door. We make our observations from that moment until you leave. A lot of people will visit the dentist more than they will visit their medical doctor, so we try to see you as a whole person and then just focus on your mouth. Sometimes things we observe here, we can make suggestions that you go see your physician because they may be a sign of a bigger medical problem. You may think we are just being nosy when we ask you all the health questions about your general health, about your medications, about your herbs that you're taking, but all these things can affect your mouth. Let me give you a few examples. Did you know that someone with diabetes cannot fight off infection as well as someone without? So you're more susceptible to gum disease and tooth disease. How about high blood pressure? Some of the medications that you take for that can cause an overgrowth of gum tissue and inflammation. Antidepressants, anti-anxiety medications, antihistamines, they all dry out your mouth. So if we know you're taking these medications, we can help recommend products to combat those symptoms, because you may need to take the medications, and this will help you deal with your symptoms easier. I know some of you hate when I take dental x-rays, but they are also necessary to give you the most thorough exam. There are some areas in the mouth that can only be seen with an x-ray, and if we go by your signs and symptoms or what we see, we're not going to catch something unless it's a big hole and you're in pain. So if we catch it early on an x-ray, you're looking at maybe just a filling as opposed to a root canal, a crown, or possibly even an extraction. I assure you, we don't take x-rays more than necessary. And we use a digital x-ray system which decreases your radiation exposure significantly. This all happens before we even start to clean your teeth. Then while we're scaling and polishing, we are checking the surrounding tissue for any signs of infection or oral cancer. You may have noticed that the doctor does an extra check at the end of your exam with a mirror and gauze. That's to check for oral cancer. The guidelines have changed that not only smokers are at risk for oral cancer, but anybody can get oral cancer. We've seen healthy, non-smoking patients have signs of oral cancer. And with both the hygienist and the doctors looking, we're more likely to catch something earlier, which is always easier to treat. So don't be alarmed if your tongue gets grabbed with a piece of gauze or gets turned over side to side. We're just trying to make sure that we check everyone to be safe. I hope next time that you're in our office and you're asked to fill out a health form or get some x-rays taken, that you remember that we're doing this to give you our best care. And we hope to see you soon.